Dialysis usually involves spending several hours, 3 or 4 times a week at a dialysis center. Now, home dialysis can help patients feel stronger, healthier, and more in control of their treatments. Dr. Brian Stone of Desert Regional Medical Center in Palm Springs examines the advantages of home dialysis.
Well, we have a large population out here of people whose kidneys have failed. And the question becomes, what do you do with those people? They really needed to get a kidney transplant at some point. And the kidney transplants are just not readily available. So dialysis has been used really since the 1960s as a bridge to get people over to transplant. The problem with dialysis is that it takes people out of their normal life. They have to go to a clinic 3 times a week. They're there for 3 to 4 hours each time, which means they're not at home with their family. They're not doing things they want to do. They're not going to work. So it really limits their productivity. But we actually have patients who connect themselves to a machine that cleans their blood for them, just like the kidney would do, and they do all of this at home while watching a TV show or talking to their family, and they're very comfortable doing it. We look for people that are highly motivated. They really have to want to take care of themselves. They want to take control of their medical care. And I think that people nowadays really have to control their medical care, even seeing a doctor for other things. But this is clearly an additional level that they're taking it. Now, this patient is actually setting up the machine themselves. They have to be very meticulous. Everything has to be clean. They're connecting themselves to the machine, and there's various ways to do that. And then they're running through the whole cycle, monitoring it, because their blood pressure has to be monitored, how they feel has to be monitored. We prefer to have somebody else in the home to assist them at that particular time. And we highly train them. We have a nurse in the dialysis clinic that's dedicated just to following those patients. So if they have any problem, she answers a phone call immediately, she runs to the house, whatever they need, she follows up on it in detail. We don't sell dialysis as the ultimate cure. Again, it's a bridge to get to transplant. But for a lot of people, that goes on for a number of years. They may not get transplanted immediately, and quality of life becomes a big issue. In addition, what we're seeing now is the number of dialysis patients is just growing dramatically. Between the year 2000 and the year 2010, we're supposed to almost double the number of dialysis patients we have in the country. So quality of life is going to become a big issue, and saving money for the government or whoever is paying for this is going to be a big issue. And having these people comfortable dialyzing themselves at home is going to save a lot of money. We don't have to have a big clinic. We don't have to have a whole bunch of nurses, a whole bunch of technicians, and the patient feels better. It's a win-win situation. Those are the kind of wins that we need in healthcare nowadays.